pleasure to be here today with my colleague, Dr. Carol Lim, who is working as a psychiatrist at the Freedom Trail Clinic, which is run by the North Suffolk Mental Health Association. She's also a faculty member in the Massachusetts General Hospital Psychosis Program. And thank you so much for being here today, Dr. Lim. I wanted to see if you might be able to just set the stage a little bit for the vaccine project that you undertook and wrote about.
Thank you so much for having me, Dr. Cather. So when the pandemic hit, a broad shift to telemedicine took place in psychiatry. But we as community psychiatrists in downtown Boston at the Freedom Trail Clinic, we had to carry on in-person visits. We're fortunate not to have a major outbreak in our clinic, but data soon showed that schizophrenia was the second leading predictor of death from COVID-19 after age.
And can you tell us what you did to address it in your clinic?
Sure. So when vaccines became widely available in the early months of 2021, we were very optimistic, but we were surprised when our patients didn't really know why vaccines were needed. They were confused and scared with rapidly evolving information, not knowing what to believe. Many questioned their efficacy and believed they were harmful. So at that point, we realized we needed to do more to help our patients, and we discovered the position we're in. We were patient sole providers and primary point of healthcare contact due to interruptions in non-emergent services during the pandemic. We created an easy-to-use vaccination monitoring tool in the electronic medical record, and we provided education to our clinicians to help them better address vaccine-related questions. And we held monthly rounds to review the progress as a clinic.
Fantastic. So really a three-pronged approach there, where you're documenting it in the medical record, you're educating providers about how to talk with people, and then you're tracking what's actually happening over time. And what did you find?
So vaccine hesitancy definitely decreased over time, but practical barriers like scheduling, transportation, and remembering appointments remained, preventing even willing patients from getting vaccinated. So all clinicians at the Freedom Trail Clinic work tirelessly with care teams and family members to help them overcome barriers to care. After just about 5 months of implementing this program, the percentage of fully vaccinated patients in our cohort of about 200 clozapine patients rose to 84%, significantly higher than the Massachusetts average, which hovered between 62 and 77 at the time.
What a wonderful result. And, incredible to hear people taking on even more during a time that was very difficult for everyone. So what are your next steps? What's the next study you want to do?
So, this study kind of showed us what psychiatrists can do when they're not unburdened by bureaucracy or regulatory concerns. And it took some courage to try something new together, expanding our role a little. And for now, we're planning on preparing for the fall and making vaccine-preventable illnesses a legitimate concern for community psychiatry. We want to broaden our discussions beyond COVID-19 to include other essential vaccines. Maybe our story inspires others to take on active role in public health and infection control beyond more traditional psychiatric tasks.
Thank you so much.